So everybody will just have to accept the recording there. We have a huge amount of questions in. Actually, there's no way we're going to get through all these questions, you know. We'll have some in the chat as well. One thing I think we should do, Rajvinder, is some of the I'm going to start making a note of the very common questions and do short videos on them, and then just refer people to the videos. We can put them up on our YouTube channel, because there are certain questions that just come up again and again and again. In actual fact, someone was on to me. One of those questions is from, let's see, it's from, we can take this while we're waiting for the others to come on. It's from Grant Devonish, and the question is, he's a small dose of tinnitus, and it's making him very anxious and low, and would be pleased if there's anything you can recommend to help with this issue, you know. So that's a question that actually comes up quite a lot, you know, and we have discussed it in depth at various times. I think it's generally considered to be a Vata condition, and I think, well, I mean, one of the things we did recommend was meditation as a means, even though sometimes people get the ringing more when they start to meditate, but over time it dissipates, you know. But I know there are some other things from an Ayurvedic perspective as opposed to meditation. So maybe if you want to take that, Rajvinder.
For tinnitus, we have recommended nasal drops as well. MP16 we call, because it's all the sinus area. The ear canal is connected to your nose and teeth and all that. So sometime you have to see there's nothing else going on, any ear infection, any blockage in the nose, any tooth infection or anything. So then even there is a dryness in the ear canal, the dryness, the bone can rub against each other, that can lead to the noise, that hollowness, because one of the quality of Vata is space element. So when the space element is there, that lead to noises. So to deal with that, the oil is the way. So I don't directly recommend oil into ear unless you're purely sure there's nothing going on in the ear. Then you can use special ear drops, but the nasal drops are very good. They're safe enough. So just 2 drops into your each nostrils and sniffle it up, and they are very helpful. But if you're someone who is a IT profession, you need to kind of monitor your screen timing as well, take a break from screen and all that, and go to nature's walk. Maybe some of my detox people are here. I was recommending them walking bare feet on the ground, because that kind of ionic exchange with the Mother Earth, that help. If you are somewhere living in an apartment and say, oh, I don't have access to the ground, and they were talking about some socks which have that iron element, you can buy those socks and sheets, stuff like that, and people were saying, yeah, it is helping them to calm their mind and all that. So look into that. So grounding, earthing. And then we have Brahmi Gritam. I will type that on the chat. Brahmi Grit is very good for Vata people, because Vata is a buzzing mind all the time. The chit chat is going on in the brain, so they need to calm that chat. So you can use nerve tonics. Brahmi is a very safe one, and it is with the ghee, which is clarified butter preparation, and ghee is a good fat for Vata people. So healthy fats are recommended for Vata people. So these are some of the simple things that you can do at home. Make sure you go to bed on time and you have a good routine, and nothing comes out of the blue for Vata people, because that's kind of throw them away a little bit. And in the cold weather, you cover yourself really well, even though it is sun, but for Vata people, it could be slightly chillier around this time, evening time. So make sure you put up your socks or and increase the temperature a little bit. So yeah, so just to the cold element, deal with the dry and cold element of Vata.
Yeah, and the good thing is it's definitely something that's reversible. You know, we've had great results with people with tinnitus, and meditation I would recommend. It's great for settling the mind. It's great for everybody, but it's particularly good for Vata people who have, you know, buzzing mind all of the time. You know,
just to let you know, Dr. Brandon is on the call as well.
Dr. Brandon is on as well. I see Dr. Nahid there. Hello, Dr.
I
Nahid.
see, but she's on mute. Yeah, she's there. Hello, Dr.
Nahid. Hi, Dr. Nahid. Is your camera on, Dr. Nahid?
Yes.
Yeah.
Oh, you're there. Yeah. Okay, I see you now. Yeah, I see you now. Okay, Rajvinder. So that's I've unmuted Don as well. Hello, Dr. Brannan.
And we can't hear Dr. Brannan. He's talking, but we can't hear you.
Good
evening. So your mic.
Oh yeah, it's coming now. It's coming now, I think.
Yeah.
Say something.
Hello, Rajvinder.
Hello, Dr. Brennan. How are you?
Hello, Nadine. How are
What
you?
about me?
Oh, no.
Hiya, Dom. Yeah, we can hear you fine. We can hear you fine. So listen, just people look out for Dr. Tritelli and just mention if she's there. So MP16 and Brahmi Ghee and meditation and looking after your vata are the things that can benefit. And then also, if it starts to get worse in any way, then we obviously always recommend a consultation as well for people. So Naheed, I have a question for you actually. This is from Emma Healy, and unfortunately, Emma had a miscarriage back in February, and she'd like to ask the doctors about restoring her health after this. She has anemia and still spotting with heavy periods ever since. We'd love to hear what the doctors would suggest for me. So that's Emma. So unfortunately had a miscarriage in February and is still suffering from that.
Okay, so Emma, I would say that the first thing would be that you try to be like positive because, like losing a child or like having gone through the miscarriage, it's actually more like I would say more a mental trauma than a physical trauma. And obviously, because there is a lot of loss of blood, so you might feel weak for quite a few weeks. And you might feel anemic and you might feel more colder than usual. Then I would say try to have more iron rich food in your diet, and that could be dates, that could be beetroot, that could be pomegranate, that could be iron carrot. And we have also one of the herbal composition with us, which is like for the iron supplement, so you can take 2 tablets of both in the empty stomach. And I would say try to take some legis rasayana because they are going to balance your apana vata. So when there is a miscarriage or there is anything like abortion kind of a thing, anything is there, then your apana vata is one of the subtype of your vata, they goes out of balance. So you need to bring it to the balance because when your apana is imbalance in the imbalance state, then your all the hormones or especially the reproductive hormones is also going to be on a toss, and that's going to make you feel like more depressed, more low kind of a mood. So I would say try having apana balance tablets, 2 tablets before your breakfast and before your evening meal. And iron supplements from we have iron supplement as well, take 2 tablets also before food. And try having iron rich food, try to be positive, try to doing some kind of breathing exercises because they're going to relax you. And if you could do a oil massage, so that would be an excellent thing to keep yourself like in a balanced state. And if you think that there is a lot more going on, then I would say you can take a consultation with any of the doctor of your choice, and they can give you like a customized scalar make kind of advice as per your body type.
Okay, Naheed, that's very valuable advice. So if you could just maybe type in the balance is MA3347, I think, and the iron supplement is MA600. Just in case people are looking, it's best to have the MA numbers. MA just stands for Maharishi Ayurveda when you're looking for things. But also a consultation is possibly a good thing as well. So Don, there's one here for you actually.
No.
Sorry.
Can I just add? Well, first of all, Chitrali, I see, has joined us. But just to add to that, it's a painful thing to have lost a child. And if you stand back and you look at the whole context in which Ayurveda arose and the background understandings, that we come and we live a life, and then when we have fulfilled our purposes, we go back home, and then we need more to learn, we come again. And in the process of these reincarnations, we build up relationships with people with whom we manifest again and again. And obviously, when you conceived a soul, it was because of huge background of lifetimes in which you and that being had an immense close relationship. But that being did not need to learn a lot in this life. However, the being manifested for you to repay that being. So that child came to you, and you gave birth to that child. Well, you gave birth to the conception, and that was returning karma, returning love, returning support, returning life to that soul, a debt that you owed the soul. And even though to our mind it's so tragic, the truth is that that soul's purpose in manifesting was fulfilled, and your responsibilities to that being were totally fulfilled, and there was no need for the soul to continue. But the soul went back home, and we'll all go back home too, but just know that there's a greater reality in which all of this is played out. And though to our minds it's inconceivable and not comprehensible, there is a manifestation of love that happened that left you richer and her richer. And you just relax and be fulfilled in having conceived. And then all that Naheed is saying will bring you back to a good, strong physical balance. And your physiology will be more integrated in future, particularly the use of the oil massage and the ladies tonic in the hopes of further conceptions if that's what you want. So I hope that also is of help.
Yeah, okay, Don, it's a very, very good point. It's sometimes we don't know the reasons why things happen, or we can't see the overall picture, but if we believe in, especially from the Ayurvedic perspective and the meditation perspective, where, as you say, we're just down here to learn lessons and then go back home, Anyway, Don, there's a question for you. It's, can I ask about treatment for benign enlarged prostate? And perhaps this could be a question for Dr. Brennan, so they selected you out for that, So a benign enlarged prostate, Don.
A benign enlarged prostate, unfortunately, is something that probably Noel, you and I have as well. So we share this.
Then I listen to your advice very carefully.
But it's a truth that, men as they go on, their prostates enlarge, and then for some, unfortunately, it becomes problematic. But remember that the prostate is in a vata area of the body. Vata is the process of movement. So there's a lot of movements that happen from down there, like urine and feces and flatus. And Ayurveda says it's not wise to suppress natural urges. So I'm afraid if you got to go, you should go. And if necessary, take a walk out of the social situation so you can sort of not end up suppressing a natural urge. I think a second simple thing to remember is that you happen to be sitting on your prostate, and if you spend an awful long time sitting, you're really limiting the flow of circulation to the prostate area. So it's another reason to be mobile and to move around. If you're thinking of a herbal preparation, I think that with the prostate balance herbal, and I would certainly take one twice a day, or if I was more symptomatic, I would take 2 twice a day. And I'm sure the ladies will have some suggestions to offer as well.
So exercise on movement. Actually, I mean, they're saying sitting is the new smoking. In other words, staying in the one position on a computer or watching TV and not getting up and moving is not really good for our health at all. And so every half an hour or every hour, you should get up and take a walk around, even if it's just for 5 minutes or stuff like that. And, you know, so many people just sit at a desk for the whole day, and it's very easy to do once you get engrossed in what you're doing. But just remember to get up and move about the place is a good idea, you know.
Yeah, I'd avoid fried foods and processed meats, and I'd go a little bit less in the direction of cheese um, um, and red meats. And research may suggest that the omega-3, omega-6, so if you've a rich source of the omega fatty acids, that could be fish, or it could be flax seeds, a mixture of flax seeds, linseeds, sesame seeds, and zinc is a useful thing for the prostate. So you're thinking in terms of peas and sunflower and linseeds again, and whole grains, leafy greens. Brazil nuts are good. I'd take, you know, maybe 2 or 3 Brazil nuts every day because it also contains selenium. And they say as well that tomatoes are full of lichen, which is a natural substance that may be helpful for the prostate. So those in terms of foods. You're probably in a Vata time of life, so try and learn not to strain. Try to, you know, question as to whether your habitual ways of going about life are completely relevant to a time when you should be taking life easier. So that may also be something to think about.
Okay, very good. So we'll take one from the chat.
There's a question about that, Noel. The prostate support. That's the herbal.
MA1595.
MA1595. Great.
So there's a question there from Una Miller, and she said, what supplements would be good for the brain? 4 months since a fractured skull and a bleed on the brain. So Dr. Tritelli, welcome along. If you want to take that question. Just someone had a fractured skull and a bleed on the brain.
Yeah, sure. So that looks like a big trauma. So to recover from that, basically, youthful mind will be one of the good herb. There are good collection of herbs in youthful mind, so which will soothe the nervous system as well, because the nervous, when there is a fracture, it seems to be a damage to the nervous system as well. So youthful mind will be a good herb to go with, because it has like Brahmi, so which is a powerful brain food or a brain herb, and then it has other Guduchi, all these herbs, Shankapushpi, so which will help to calm and soothe the nervous system basically. So this tablet can be taken like 1 tablet after meal, after lunch and after dinner. So this will be a good herb to go with.
Yeah, and I think meditation again would be a good thing it's good for the brain anyway. It mostly works on the brain. Well, it works on the whole body, but definitely the brain as well. So a meditation technique like TM or something like that. And youthful mind is MA3. So yeah, so those 2 things. So I'll go to Redfinder now. This is from the emails again. And someone asking about how to treat varicose veins. Is there anything possible besides weight, diet, and good lifestyle? What can be done? Are there any possibilities beside the right diet and good lifestyle? Well, you know, the right diet and good lifestyle is what Ayurveda is all about, you know. So, but anyway, and that's what you should be aiming for, really. But anything can be done for varicose veins, Richvinder?
Yeah, you can do because it's the strain. Maybe you used to stand a lot or sit a lot, and that's the strain on the veins on the extremities. So you need to take off that pressure, Depends on your age. I don't know what age group you are. So start doing some restorative exercises, like aqua aerobics will be very good, or anything walking in the pool if you're in that age group where you can take strong exercises. So they are very good. Water activities are very good for varicose vein or anything like that. And then every day, 10 to 15 minutes, you hang your legs against the wall, or you just kind of lie near the wall and raise your legs up. So that kind of push the bloods down, and it open up any blockages or anything. If there is any blockage, make sure your cholesterol level is okay. There is, you will know from your blood pressure on that there's not plaque formation happening. If any of that is happening, you can take simple Marishar with Rasina, which is cholesterol balance. It is basically turmeric and guggulu, and it is very good to thin the blood. It's not a blood thinner, so it's not going to thin the blood up to that level. But if you're on blood thinner or anything, you don't take that. So just start that if you are healthy and not on any medication, 1 to 2 tablets a day. And you can also rub upward towards your heart the oil, dashmul oil or simple sesame oil, to ease up the circulation around it. There are certain stockings, I'm sure you're aware of those, and you're wearing those stockings. These are for varicose veins. And in the health store, there's a particular cream made from chestnut oil, I think. That's also very good. So these are the simple things that you can try. It's the strain. So find out the strain, where is it coming from? And considering, like Dr. Ben was giving very good advice about the antioxidants. So some kind of antioxidants like CoQ10 or lutein will be very good, because these are the free radicals that causing this damage to your veins. Okay.
Okay. So Nahid, this is one from the chat. What to do for lung heaviness, some pain and lots of mucus, more in the winter, Avata non-smoker. Thank you. Nahid there?
She's there. She's on the mute though. Unmute her.
Okay. No, Nahid.
Hi. Thank
Did you
you.
hear the question?
Yes, I can hear.
Did you get the question?
Yes, about the
Okay.
mucus and the chest heaviness. Yeah. So I would say that the chest heaviness and the mucus is a sign of that there is increased mucus, increased kapha in around the chest region. So the liquid which is present in our lungs is nothing but one form of kapha. So if for any reason, because of the infection, because of eating too much of cold food or like eating heavy foods, if your kapha has gone out of balance, then that leads to excess mucus production. I would say that try having Shito Paladi. We have a combination of herb in the form of powder. So you take it and you mix it with honey and you take it twice a day. And then I would say that try doing some breathing exercises, because it will help you to clear your lung passage. So it will help to drain the excess mucus, and it will also help you to like release the excess mucus production. And it's happening to you more in the winter, then I would say that get yourself prepared before the winter. I would say try doing some detoxification before the winter starts, like during the fall season. You can take chavan prash, so you can take 1 tablespoon of it before your breakfast, or maybe you can take after your breakfast. So that will help you to keep your chest healthy, and it will help you to prevent the excess production of the mucus. If you're a non-smoker, then I would say, and you can also take trikatu. So trikatu helps to balance the kapha, and it also helps to reduce the mucus production. So you take it like maybe around a half a teaspoon before your evening meal. So try all these measures. If there is no underlying cause of the excess mucus production, then I would say this would help. But if you have something underlying, lung disease like bronchitis or bronchiectasis or anything like that, then I would say you need some intense measures. So you first need a diagnosis, and then the protocol of the, like the treatment will go ahead.
Okay, and Citopalati and Trikatu, they're all powders that we sell them in powder format, So, and Trikatu is quite strong, and it's used to help with people's digestion, but they're all things that help to reduce kappa. And you're right, the time to start working on it is before the winter comes in, you know,
Yeah.
and learn a pranayama technique to strengthen the lungs. So you could just go online and Google that and learn some breathing exercises to help strengthen the lungs, you know. So Don, one for you. Yeah, Gregor says, has Ayurveda a way to reshape flat feet?
Reshape flat
Feet.
feet.
Yes.
Uh,
Some way of putting the arch back into the foot.
You need to go to the shoe specialist and get your shoes kind of made that way. Then they give you special insoles for that. So orthopedic or something, I think they call those kind of shoes. Because that's the condition, I guess.
I think that the other thing that comes to my mind is a book called Pain Free. Pain Free is a concept where our body goes out of alignment, and that influences the carriage of weight down through the various joints in the body, and ultimately it lands on the feet. And the feet should have two beautiful arches, because the weight really should come down onto the double arch of the foot, so the weight is distributed around. So if there's a flat foot, the arches are failing, and it may then cause a splaying, which causes an uneven distribution of weight on the foot and pain as a consequence. And so one of the chapters in the book would deal with the feet, and it gives exercises not necessarily dealing with the foot itself, but with the distribution of weight down your body. And it could be that, you know, some exercises like that might help to realign your body, and that could contribute to more comfort in your feet. And at the same time, the orthopod that Rajvinder is suggesting would be another way to relieve the discomfort. So that's the only thing that comes to my mind.
Okay, well that's two things anyway. That's the shoe and the pain-free book.
Pain-free.
Okay. Okay, Tricelli, there's a Madeline on the chat that said, any advice for dealing with an E. coli infection causing upset stomach? It started 2.5 weeks ago.
Okay, so E. coli infection, usually this is a bacterial infection. So you have to, like, for this, first of all, what Ayurveda says is, like, if you have any stomach infection, it is due to, it causes indigestion as well. So better to fast and drink warm and boiled water first thing. And then pomegranate is one of the good fruit which can help to combat this E. coli infection. So eating pomegranate or just squeezing juice of that pomegranate will also help to slowly get rid of this infection. And then there are few herbs like neem and then kutaj and even dry ginger powder. So you can make a decoction of these herbs and then drink it. Like, just take 1 cup of water and then 2 pinches of each powder into that water. Boil it until it becomes half, and then that half cup of decoction, you can take it once in the morning. So this will also help to slowly, like, it will act as a carminative and a digestive herb to slowly get back to your normal gut flora. Okay, then even having a light rice grill will also help to slowly, like, putting little bit of cumin powder into that and rock salt, and just cook that well, pressure cook the rice and eat that. So that will also help slowly to increase, to get rid of that infection and slowly get back the digestion process back to the normal. Okay.
Okay, that's good advice. And actually, we're going to be doing a webinar on gut health very soon anyway, sometime in the month of May, because it's, you know, it's something that's really, really important in Ayurveda, is that you have proper gut health and the microbiome is operating properly. And so many things can put that out of balance very easy. So we're going to be doing a special webinar on that in the month of May. So keep an eye out for that, you know. Don Maureen is asking, maybe you've already done it, if you could put in the supplements for the benign tumor or for the benign prostate.
Yeah,
If you could just get them in.
Nahid kindly put that into the chat box.
Okay. So then we are back around to Rajvinder, I think. Any advice on pain in the lower back, which goes around to the groin, and it's painful when getting up from a chair? Also, leakage occurs. So, any advice there, Raj? So, pain in the lower back, which goes around to the groin, and it's painful when getting up from a chair. Yeah.
Seems like there is something going on with your spine. Could be a disc problem or something. So need more details. Why is that? And if that's happening, sometime it press on the nerves, which could be connected to the bladder, and that's weakening the bladder. So on the top, just to recommend, I can say start using joint soothe oil massage. You can get the joint soothe oil and start rubbing on the lower back a few times. Once you reduce the inflammation, I think the pressure on the bladder will ease up. And if you are able, just lie on a soft yoga mat, and then just raise your legs a little bit, and raise and low, raise and low. And don't raise it like 90 degrees or even more than 30 degrees, just a little bit. Do that. And if you have same as I said to the other person, access to water activity, water is great for back issues. You can do that. You can sit in a sauna or something warm. That's also nice to ease up that inflammation from the lower back. Otherwise, just do the joint soothe oil and little hot water bottle for the hot fermentation, and hopefully in a day or two you're able to bring that pain down, and see if the bladder is connected to the pain. If it's a separate issue that the leakage is happening, even the pain is not there, then you can take MA2, which is a Genitrack, just to strengthen the bladder and all that area. So just start with MA2, just one a day, and joint soothe massage. Make sure there is no constipation and anything like that.
Okay, and the joint soothe oil is MA929, and the Genitrack, which is MA2, is that the Rajvinder said, you know. So there's one coming in from the email now, and it's just, is it possible to rebuild knee cartilage? I don't think so, but Dr. Brannan, you look at
Depends on your age. Depends on the age.
Depends on the age.
Yeah.
Okay, do you want to elaborate on that?
Okay, sorry, Dr. Don, I'll let you after that.
No.
It depends on the age. It's the collagen that need for the cartilage and that kind of. So incorporate a good collagen supplement and bone broth. Amla berry is also very good. Shilajit, we don't sell Shilajit on its own, but if you're a man, Vital Men is very good because it has Shilajit in it. And so I kind of suggest that, and a regular castor oil massage on your knee, just application of castor and wrapping it, that can help. So depends on where the weird here is. Are you a sport person? Was there an injury? So there's a lot of factor to consider. So worth giving it a shot before you do anything.
Possibly worth a consultation as well, because if it keeps getting worse, it can become a very painful thing as well, you know. I'll give you one, seeing as Rajvinder took that one, you know. I would like to ask regarding my granddaughter, who is 6 years old. She has got allergic and eczema since she's 1 year old. Her eczema is bad, but under control with E45 and other creams. Please suggest if we can cure it with Ayurvedic medicine. So a 6 year old, she's got allergic and eczema. I'm not sure what that means, that she is allergic, and so she's allergies, I presume, and eczema. Since she was 1 year of age, and that's from Renu.
Yeah, well, the poor dear, it's a very irritating condition for her. I think turmeric is a good spice to include in the diet because of its anti-inflammatory effects. And I think aloe vera is something very nice as well. Even perhaps she's 6 years old, you know, 2 teaspoonfuls after a meal. and I suppose I'll hand it over to one of the Viges, because I think they'll have a lot more to offer, being mothers of children who were 6 or will be 6. So, hand on me.
Need any ideas on eczema for a child?
Yeah, I would say that the first thing I would say, any skin condition is mostly related to if you are eating any incompatible combination of food. So I have seen in many patients that once they eliminate the incompatible combination of food from their diet, it reduces. It might be that you're mixing the bananas and the milk together and you're giving the baby, or maybe you're cooking something with the fruits on and like other things on, or maybe you're giving honey to her. So this could be the triggering factor for her eczema. But I would say whatever Dr. Brennan would have advised to soothe the eczema, I would say apply the coconut oil, apply the aloe vera gel, that will give a soothing effect. You can add turmeric into her diet. You can even give her, because she's so 6-year-old, so I would say you can use manjushtha, you can use, so you can give her just one pinch, so the amount which comes in between your thumb and your index finger. So just take a tiny pinch of that and you can mix it with a little bit of ghee and you just let it lick. Okay, and this will slowly help to calm down like the doshas, and it will clear up the skin. So manjishka helps to clear up the skin. And try to just figure out if there is anything in her diet which is making her like allergic, or which is making the eczema goes more worse. Try to eliminate that from the diet. I would say that will help. Just try not to give fruits and like cook food together. Like when you're preparing a meal for her, then the fruits and like the cooked meal, any form of the cooked meal together would not be a nice idea. I know like it's tough for the babies because they're picky eaters sometimes and they go on to eat everything. But try to keep the raw foods and the cooked foods separately. And I think that would help.
Okay. So there's one from the chat here, and it says, any advice regarding MS and slowing its progression? Thank you, Rajvinder. Or Dr. Trisali, sorry, maybe we'll go to Dr. Trisali. Any advice on MS, Dr. Trisali, or any of the doctors that have dealt with this can step in here?
So MS is what
Multiple
does it?
Sclerosis.
It's a multiple
Multiple
sclerosis.
sclerosis. Okay, so for multiple sclerosis, so it is again an autoimmune disorder, and for that, basically, all the Rasayana herbs will help, and even detox. So that is one of the major thing I would like to emphasize on. So doing a detox will help for this myasthenia gravis, and then even
Sorry, multiple sclerosis.
Sclerosis, sorry, multiple sclerosis,
Sorry
for
about that.
multiple sclerosis. And then few other herbs like amla berry. So amla berry will also help for that. And yeah, that's it. Any other doctors want to give an insight?
I think it multiple sclerosis, because it's it depends as well on its, how strong is it, because multiple sclerosis can be a mild or a rapidly progressing and very severe condition. And certainly if it's mild to moderate, I think your Ayurvedic approach is very significant and can give you a lot of control over it. And my advice would be to find out more about Ayurveda. If you haven't done the 7-lecture free course on Ayurveda, do it, because you want to learn how to live a life of balance. And the more you understand about yourself and the more you can apply these principles, the better will be your ability to prevent the progression of the condition. As Dr. Chitrali says, it is some sort of autoimmunity which is attacking your own nerves. So you want to, heed her suggestions, like some little detox could be very helpful, along with tonics for your nervous system, and there is a regen nerve preparation that is available as well, that Noel makes available, that is a worthy tablet to be taking on a regular basis. But I think it is a Vata condition of the nervous system, but in my experience, it's often Pitta people that end up with it. So I often go in that area of trying to calm their Pitta and not take on too much in life and be overly aggressive with the way you go about life, but having more of a work-life balance and having more quality time in your life for the Pitta's sake, and then for the Vata's sake, good routine, good rest, meditation, oil massage, very significant. I think the almond oil is good for the nervous system and not too heating. There is special Ayurvedic oils for the nervous system. Is it a Balitile? What would you say? Ask one of the Vajas. For the nervous system, Chitrali, what oil would you massage?
Mahanarayan Tel.
Yeah, Mahanarayan.
Mahanarayan. But I don't think we have that one, no.
But
But
we
No.
have
have
the
Vata massage oil, and that's quite good.
Oh yeah.
yeah, Vata massage oil is good.
We have Brahmi Ghritam. That could
Yeah.
be nervous
Yeah.
system.
Brahmigrit.
Brahmi grit is a ghee preparation that you could take a teaspoonful of, or twice a day. With that,
Even could be applied on the, if that's what you recommended. Could be
Apply
applied.
the
The
head.
Pichu on the scalp. I would also like to add on to something to MS because that's I had a few patients with MS, so I would say that it's a severe Vata kind of a condition, and Dr. Brannan is absolutely right mentioning that mostly the people gets with MS because there is a more tendency of developing an autoimmune condition in a Pitta people, but Vata and Kapha people can also have it, but there is a tendency with the Pitta people. And that makes it a bit tricky because, like to balance Vata, you need everything warming, everything like hot in nature. But at the same time, you need to keep your Pitta in a cool state. And that comes a challenge. But if you take Ayurvedic measures, whatever Dr. Brannan has mentioned, that if you just take care of your daily routine, if you take some of the rasayana and the detoxification, so initially I would say you just get a check with any of the doctor that whether you are on a state of to do the detoxification at the moment or not, because you might be a kind of your bile is not ready to take it because your bile is like so much affected with a lot of Vata imbalance. So get that checked, get a detoxification done, and take rasayana. We have multiple rasayana like the Brahmigrita, MF5, MS7. On a prolonged use is definitely going to slow down the process depending on in what condition you are and how many years back you got diagnosed and what are the symptoms you have. So just to give you a hope, I would say you can slow down your process and you can feel a much better after taking all the Ayurvedic measures.
Okay, and if you haven't done the 7-lesson free course, and anyone that hasn't done that should do that, because I mean, if you haven't done that course, you're probably a bit at loss here when we're talking about Vata, Pitta, and Kapha. So go to ayurveda.ie, and it's on the homepage. It's the course that we promote over and over and over again. It's an absolutely fantastic course. The feedback we get from it is brilliant. We've had thousands and thousands of people do that course, and as far as I'm concerned, it's one of the best introductions to Ayurveda around. And there's a whole section on Vata, and there's a whole section on the daily routine as well. And these are all the things that everybody, regardless of whatever condition you have, can make use of, So just ayurveda.ie, you'll find that. So Rajvinder, we have a lady here, what to do for pain under the soles of both feet where it meets the toes. Left foot, joint under big toe is swollen and painful. Was very red, but calmed down now. Have rheumatoid arthritis also. Hands, wrists are painful and hold back. It hurts to walk on feet and my hips hurt when I start to move and walk. In a lot of pain at the moment. Well, one thing you could do is look at the arthritis webinar that we did. We did a special webinar on arthritis, so you could definitely take a look at that. Gillian, if you want to send me an email, noel@ayurveda.ie, I'll send you a link back for that arthritis webinar, and you can just take a look at that. But Rajvinder, any general things there that we could?
Yeah, she definitely need to talk to one of us, because need to sounds like arthritis in the sole of the feet that's affecting the sole of the feet as well. So, and if the rheumatoid is very acute, then I'm not going to recommend oil massage. If it's chronic and not swollen red, because in the rheumatoid there's like a scorpio bite, that kind of burning sensation, that kind of pain, and that is very acute state of AMA. There's a lot of toxins, AMA we call it, present in the body. So you need to work on digesting that AMA. So you can start drinking cumin, coriander, fennel water, where you just can put a kind of a half a teaspoon of cumin, coriander, and fennel, each of the spice, roughly 200 ml water. You can steep it for an hour and sip it. That will help to detox some of the toxins from the system. And if you can fast, try not to eat something too heavy for at least 2-3 days. You can eat simple dal. I hope you know what dal is. And dal is a yellow mung lentil available on the website. And you add vata churna in it and a little bit ghee to flavor, and then cook until it becomes mushy, like a soupy. Or you can make some veg broth or a little bit bone broth, something liquid, and let this inflammation digest away from your system. That's the simple thing I can tell you can do now, but definitely need a lot more details to deal with rheumatoid arthritis. It is manageable, have very good result with other people with rheumatoid. So yeah, you just provide you just book up a consultation to go through all the different factors, what is contributing to this. Yeah, because you're very careful about the massage and everything. There's a lot of precautions you have to take so that it's not spreading to the other joints.
Okay, so we have one from the email now. This is from Barbara, and she would like to know what should she be doing to help with lethargy, night sweats, depression, headaches, general pain, aches. Yours sincerely. So actually, you have a lot going on there, Barbara. Night sweats, lethargy, depression, headaches, general pain, and aches. I would say, Barbara, you need to look at the 7-lesson Ayurveda course and start to adopt an Ayurvedic lifestyle. I'm not sure if the doctor is just, I mean, there's 5 or 6 different things going on there. So I don't know, Don, if you want to say something.
I just wonder what age she is, Noel. I mean, with the night sweats, is it a change of life thing that we should be trying to balance? Or if it's not that phase of life, then I think you're right. The general measures of knowing how to take care of your digestion and having a good routine and getting appropriate exercise are all relevant to get you feeling better. With the lethargy, the depression, I mean, a bit more information I think would be needed before we could give.
I would say there's so much going on there, Barbara, that you need a consultation. You need to sit down with an Ayurvedic doctor for an hour and go through everything. And you can't treat all of those things in the one go. Well, you can by adopting changes in your lifestyle, but you need to be targeting in on specific things and working on them and then moving on to the next thing, you know. So my advice really would be to have set up a consultation with one of the doctors, you know. So Anne is saying that she wasn't able to do the detox because of circumstances beyond her control. She's 64 years of age, good health. Is there a light detoxification I can do at home myself? Yeah, well, Anne, you could just eat lightly for a few days. I mean, just to have the khichdi and the dal and just eat lightly and stay off coffee and tea and meat and gluten and breads.
But if she wants to set up a plan for her, definitely she can talk to one of us and give her a proper plan rather than.
Okay, that's the other thing you can do is have a consultation with one of the doctors, and then they just organize a separate. I mean, we do those detoxifications, you know, like twice a year, those group things. But anybody can contact the doctor and do it under the supervision of the doctor. The only thing is we don't like to do detoxes unsupervised, and we just like
still going on. If she likes to join, still people.
No, she can't join. Yeah, no, but you can talk to one of the doctors and do a treatment under one of the doctors. That's and then maybe just eat lightly is something you could do as well. You know, John Shields, friend of mine from Dundalk, is on there. If it's the same John Shields, he says, as a Pitta Kappa enjoying the paradise of the Vata stage of life. That sounds very good, John. I would appreciate any advice about balancing Kappa, as I am tortured by sinus issues. I'm doing Nasya and also sinus rinsing. I'm trying to cut down on sweet stuff. So I think you know, John, Don, I think maybe.
Isn't it very sad that a man who loves the mountains gets up there and he can't breathe in the mountain air?
Yeah.
God love you, John. Yeah, you're on the ball and you're doing things right. I'd be very cautious with dairy. If I took dairy, I'd think about stopping it for a while to see how that helps. When you, yes, again, look at your digestive system, because certainly it can form the ama, which is coming out as catarrh mucus in your sinuses. So be wary of overeating, and be wary to have the main meal in the middle of the day, and use lots of digestives, like that decoction of chopped ginger with a little lemon, salt and honey, taken before meals, teaspoonful or two, would be a good digestive to use. There's also a very good combination called Trikatu. You can get off the website, Trikatu, Trikatu. And so the Trikatu would be a powder that you could take with honey or a bit of water after the meals, 3/4 of a teaspoon. So a little digestive before and after meals, maybe twice a day, would be a good start. And look at the kapha foods then, that which is avoiding anything very oily and heavy and cold. But you probably know of the kapha food lists yourself, John. Great that you're doing the Nasya. So the MP16, or what's now called MA735, are excellent drops. And I would take them when I get up in the morning, and then I would take them after each meal, a drop in each nostril, and sniff it up. And your nose should run. And if you use too much, you can irritate the throat. So just use one drop rather than too many drops up the nose. But I would do that regularly for a month, that often. And you have the 634, which is an inhalation oil. You could put it into a saucepan of hot water and breathe the steam before putting in those nasal drops, and do that maybe 2 or 3 times a week. And don't go out afterwards, not to go in the mountains after doing that inhalation. That's after you've done that, you should stay indoors really, because you could get a bit of a cold if you went out. So the inhalations and the nasal drops, and we used to have herbals for it, but they stopped the herbal that was most specific for that. So, but the Trikatu, unless one of the ladies knows one of our herbals that would be specific and good for it. Sinuses.
For sinuses.
Yeah.
Go ahead. So there's no any tablet, but Trikatu is a good option. And again, I would suggest watch what you are eating. If you are eating excess of fruits and porridge together, so that will also accumulate more of mucus. So try to watch what you are eating first, and try not to have a lot of cold salads or cold drinks or anything. So that will also aggravate more of mucus production. So try to see what you are eating.
Okay, John, I hope you get something out of that. Go to the email now. This is from Ayushra, and it's what's the Ayurvedic view on parasite cleanse, usually done using wormwood, black walnut, etc. Is it something worth doing? If so, can it be done by everyone, any dosha? And is it good time to do it after the detox? So parasite cleanse, I presume you'd have to think that you had parasites for some reason, but so any experience with parasite cleanse using wormwood, black walnut? Rajvinder, you like the answer?
That's good. Yeah. You can any dosha can do, and it's fine to do it after the detox. For the parasite, you need. I think it's better to take them. I don't know if you're applying it on your belly button or you're taking the drops. I think you're taking the drops, and then you eat a little bit of sugar, like a few dates or something before taking it. So the parasite come to the sweet thing, and then you can eliminate them. So make sure you're not constipated after it. You really need to have a good bowel movement. That's the only thing you need to take care, and a lot of water. And don't do it more than 5 days or a week maximum. That's enough.
That's usually get done for babies, right? For children's, like school-going children, because they are more prone to get parasites. Like,
Worm infections.
yeah.
Yeah, that's deworming. That's the albendazole we
Deworming,
usually do.
yeah.
Every once a week, kind of over a month thing. But she's talking about wormwood, which is a simple oil from a herb. So that's a different thing. Because people might have SIBO, might have something else going on they want to do.
Okay, so is there an Ayurvedic regime for rhinitis in seniors? So Dr. Chitali, I think we're on to you. I'm not too sure. Or anybody that's familiar with rhinitis?
Rhinitis.
Rhinitis?
Rhinitis.
Yeah,
Okay.
Allergic rhinitis. Okay, allergic rhinitis. Okay, so for that again, Nasse is one of the good measures to go with, like during this pollen season. So when the flower starts flowering, so that time usually you get these infections, allergic rhinitis, and it's better to start doing the Nasya, and then even keeping a glove in your mouth whenever you feel like sneezing or anything, when you are going around or for a walk or running. So that time you can just keep a glove in your mouth. So that also helps to like reduce the sneezing effect caused due to the pollen. And again, few other herbs like we have on our website. So allergic hair. So that is also one of the good herb to go with.
So, you mean Allergard? Allergard. 1788, I think, is the number.
Yeah.
1788,
yeah, and Tulsi will be very good. Holy basil, that's very good for allergic kind of situation. Like Dr. Brian mentioned, Trikatu. You can mix Trikatu and Tulsi together, and you can take that with eucalyptus honey or good quality honey, and half proportion twice a day. That is very good.
Okay. So Madeline says, what was the second herb, please? I don't even know what the first herb was, Madeline. I can't wait.
I think
Okay,
that was
Allegard.
No,
just
that question was way back. Taken by Dr. Nahid. I think it was around nose as well.
Yeah, well, you might just have to
I
listen
think
back to
she
the
said
replay.
Sitapladi and Trikatu were the herbs.
I have like written
You've
that.
done that, okay.
Did you?
Okay. So now back to the email. This is from John Buckley.
Oh, no. For E. coli. She's asking for E. coli. Neem and ginger and?
Neem, ginger and kutaj. I had talked about kutaj.
Type it
dry ginger powder. I'll try.
Yeah, and then you can just listen back to the replay as well.
Yeah.
So this is from John Buckley, and many of us wake up in the night and take a long time to get back to sleep. What can we do about this? So so waking up, just
listen to Dr. Brannan's webinar on sleep. I think
yeah,
a lot of can see that. That's one
there's
thing.
a webinar on sleep on our YouTube channel. Yeah, because that is, I think, a bad. It depends on what time you wake up at, but that can be a bad condition. My thing is, if it happens to me, not that it happens to me very much, but I get out of the bed and I do a slow set of asanas, and maybe even 2 sets of asanas, and then I just fall back to sleep. But it doesn't tend to happen to me, but very often. But if it does, that would be one recommendation.
Probably that happened when you have taken cappuccino.
Sorry.
That's the day when you're drinking too many cappuccino.
Well, I don't know that John drinks cappuccino, but cappuccinos don't keep me awake. I am not drinking any at the moment because I'm detoxing anyway, you know. So this is my second day of the detox. I'm 3 days without a coffee, and I'm still managed to be very pleasant this evening, you know. So that's yeah. So John, do a set of asanas, do 2 sets of asanas, and then even meditate. I know you're a meditator, so just sit up and meditate if you want, and that should help you fall back to sleep, you know.
I
Uh,
think one other strategy I'd use now before getting out of bed, I'd be very reluctant to get out of bed in the middle of the night.
no. It's better than lying there. I can tell you that much for hours and hours. Just get out of the bed and do the asanas. You can go back. But
One
anyway,
simple, I think, John, first of all, to recognize you're in a different phase of life and that we have this natural cycle of 90 minutes where we go deep sleep and then we come back and we're very superficially asleep and then we go into a next cycle, and that happens 4 or 5 times in a good night's sleep. When we're younger, we never know this, but when we're older, at the light phase of the cycle, we can tend to wake up. And if we just stay there and accept it and not get worried about it and are happy enough about it, often we just slip into the next cycle eventually anyway. And we haven't lost anything, because it's not that we're not sleeping, it's just that we're being more alert at the lighter phase of the sleep cycle. So be relaxed about it. Unless you're exhausted through the day, you don't have a sleep problem. The second thing is that I find sometimes to direct the attention away from the thoughts, which, because the thoughts start up, can take us in the roundabout, and that makes us more and more active, rather than think, feel. So that keep directing the attention onto any physical sensations. And specifically when you're sort of used to doing this, just immediately you're beginning to wake up, you go to the body and just be aware of any sensations from there and keep coming back to that. That might send you off. If it hasn't, I think the third one I think of, rather than hop out of bed and be as athletic as Noel, I'd sit up comfortably and pull up the covers and meditate and lie down. And often after that, you'd lie down. And if you're a desperate case like Noel that has to get out of bed in the middle of the night,
I said it very seldom happens.
if it's not the coffee, it might be the pints.
They have to sleep. They have
It's
to
not
sleep.
it's not the toilet call.
But just remember, I mean, you're waking up in Vata time in the night might be because you've been overexcited during the day. Maybe you need to settle your Vata.
Okay, so lots of food for thought there, John, anyway. So is there an Ayurvedic recommendation for COVID? This probably must be post-COVID type. I presume it's low energy or depression. So we did quite a few videos on COVID, and I think we did one on recovery from COVID as well. If you go to our YouTube channel, you might be able to find it. But Don, you're kind of an expert on COVID. Well, all the doctors are, but so someone has low energy and maybe even a bit of depression after COVID. Don, you want to take that?
It's generally a kapha problem, COVID. It's generally a kapha problem. I'd see Agni, digestive fire, as the source of our energies. And it could have been that the COVID has left that very flattened. So the Agni is not just the digestive fire, it's all the fires in the tissues that transform nutrients into energy and into tissues. So I think I would be sure again to eat good quality fresh foods. I would want not to eat so heavily, so not very oily foods, not cold foods, and I'd use a lot of the digestives, and there's a herbal digest tablet. And for the metabolisms generally, I'd think about the men's tonic or the MA631. That should help other metabolisms in the body. Yeah, go ahead.
Any other suggestions?
Yeah.
Because there's a lot of fatigue, and I kind of thinking of Amrit Kalash, maybe MA7, just to boost up the immunity, because depends on what were the symptoms when the person was going through COVID. Would it have kind of deteriorate the whole physiology a bit? Have they lost weight? So kind of considering those factors slowly, as Dr. Bang said, bring the digestion back and increase the protein intake if you're able to take more protein in your diet. And I would be thinking of a nerve tonic, either Vata Balance, MA401. It's also known as Peace of Mind, whichever is on the website. That might be good. One a day. Bedtime, good bedtime routine, probably take more rest. And try not to go for too much exercise or long walks. Just for the moment, take more rest and recover from it. Unfortunately, some of the COVID is lingering on for way too long. The post-COVID people are very, very tired and fatigued. Yeah, so you might be need a 50 plus as well, just to boost up your general tonic, vitamin D, stuff like that. That's all in the vitamin, all in the 50 plus.
Okay.
In
And
the
even
daytime, if
you can
get-
just include this ginger relish in the diet so that it will at least increase the digestive fire, and it will help in digestion as well.
that's the ginger, lemon, salt, and honey.
Ginger, lemon, salt, and honey. Yeah.
And I think as well, if you get tired in the day, just in the afternoon, take a habit of sitting down and, closing the eyes and resting for 20 minutes, half an hour, just so that in the Vata time of the day, you get a little bit replenished. If you have learned TM, that would be a fantastic strategy to be using during this sort of a situation, because that gives a very profound rest.
Okay, so lots of information there. So we go back to one from the email now. Actually, we've so many questions, we've no hope of getting through them all. But anyway, so this person has been diagnosed with type 1 diabetes 2 years ago after contacting COVID-19. 65 years of age, not overweight, generally eat a vegetarian diet and exercise regularly. I believe my pancreas is still producing some insulin, as I can keep my blood sugar generally within the accepted range and only use background insulin at night. I've also have underactive thyroid and taken medication. In addition, I've just been informed that I have osteoarthritis in my neck. My questions are, is there anything I can do to help my pancreas continue producing insulin? And what do you recommend I take for osteoarthritis? I currently take Udos Omega-3 and vitamin D. So there's a lot in that. Dr. Chitali, do you want to handle that?
Yeah. Okay. So for looking at all the disorders, so these are all interlinked. What I feel is like watch your gut again, watch the digestion, how it is, and include millets in your diet. So which has low glycemic index. So there are like different kind of millet, finger millet, and then proso millet, banyan millet. So you can just try to include those millets in your diet. And regarding for this osteoarthritis, so we have like osteocare. So that is one of the tablet which you can take. And or if you feel like after taking all this tablet, even if you are not feeling better, so please do go for a consultation with either of us.
Okay. So we're back to one from the Q&A, and so this person's grandson has been diagnosed with SATB2. He is 27 months, non-verbal, and has weak bone density. I would appreciate it if you can advise me on any Ayurvedic method supplementation I should give him. I currently use tapping methods to stimulate the nervous system together with specific facial exercises, oiling after bath, various dal and protein containing food, and Makaton sign language. I'm not sure what that is, but obviously that's a system of sign language, together with sound vibration, plus keeping a close observation of his responses and meet his development needs accordingly. With thanks. So I don't know if any of you have come across that before.
I mean,
Can I take that?
yeah, please.
Yeah, Dr. Nahija, go ahead.
Yeah, so I would say that this is a developmental issue, like a delayed development on so many aspects. I would say Rasayana. Rasayana especially designed to like boost the mental health would help in this condition. We have Brahmi Grita. If you can give a tiny teaspoon, like a half a teaspoon of Brahmi Grita along with milk, and if you can just melt the Brahmi Grita and you can soak it in a cotton pad and just place it on the top of his head every day if you can do that. You're taking so many measures to stimulate the nervous system. I would say that an oil massage could really help to stimulate the nervous system. I'm not sure that whether he'll be able to like remain lying down on a place for quite some time. But if he could, then I would say just giving him a Shirodhara. Like there is Shirodhara is an Ayurvedic treatment where the oil is continuously poured over the forehead. But as he's just 27 months old, then I would say just lie him down. You just take a cotton cloth which can soak more oil, and you take it in your hands like this, and you just dip the oil on his forehead like this. Okay, so in this way, you're just stimulating the nervous system, and you're providing the rasayana, which can help the brain function. And I would say that you need to be like patient enough to just do all these measures, and you can just try, I would say, and just see how it goes. And if you need anything else, like any of the doctor can help you like in detail with the things.
Okay. So Patricia O'Hanlon says, can one eat aloe vera from a houseplant? I never
Yes.
tried it. Yes. Okay, that's a very positive yes. So you can, Patricia. There's your answer.
What I read about that is that there's a very fine membrane just inside the leaf portion before the juice, and that's very cathartic. Could make you go to the loo a lot. So just be very careful that you get only the juice.
Yeah, just the pulp one, and you can make a juice out of it, and you can have it.
What my grandmother used to do, they used to make a curry from aloe vera. So that like those days they used to cook with sticks, and all the ashes from the sticks, they used to rub the aloe vera with the ashes and then wash it off and then cook it. And then it wasn't that laxative effect. So maybe you can, charcoal would be the nearest thing. Soak in the charcoal water and then cook it. Yeah.
Okay.
And she used to pickle it. She used to pickle aloe vera.
So Sarah Wheeler says, I have eczema and dry skin, and in the last month, skin on my feet has started weeping. Only things which helps this so far is Chinese herbal cream, which I'm not sure about re-steroid content. I am Vata Pitta. Could be due to the change in season? Is the Pitta side out of balance, and how can I reduce it? If so, many thanks. So we're definitely seeing a bit of change this season, not so much really, but it's starting to warm up and get a little hotter. So we will be going into the Pitta season. So eczema and dry skin, I think we covered a lot of it earlier on in the talk, really. So the same things that were recommended for the person earlier on, you know. The feet have started weeping. Any other suggestions in this particular case?
You can apply ghee. So you can apply a melted ghee that could help you with the dry skin and the weeping feet. And when you apply, when you just wash your, like after coming from the shower, when the feet are still damp, then you apply the ghee, because the skin pores are open there, and then it will help to like absorb, and then you can wear a socks.
Okay.
And
So
try not to like wear tight socks and tight shoes. So that is also really important for that.
And maybe radiant skin.
And if the weeping is still continuing, so after, you might need a consultation for that, because there are a few other herbs which are really helpful for that, like neem, manjishta. But again, I won't suggest it right away to do that, because they might cause tingling or little numbness at that area. So it's better to do under supervision.
And the dry skin always suggests that your gut is dry somewhere. So if you're constipated, try to address that issue, and try have enough of the good fats in your diet. Try have enough of the water that you require to keep yourself hydrated.
okay, so a couple of people saying thank you. Maureen's iPad says, does this apply to gout in foot also? Maybe whoever handled that question for Maureen could answer that. Can't remember.
Yeah, that was pain in the feet.
And says thanks for the link to the natural law.
Sorry, the gout is different from rheumatoid. I think that's the question. So it's slightly different dietary stuff that you need, but we can follow the same advice if there is pain going on at the moment.
Okay. So Anne says, thanks for the link to the Natural Law Summit. It was fabulous. I don't think we sent any link to the Natural Law Summit. I know what it is, all right, and it sounded very interesting, but we didn't send the link out. As far as I know, we have our own. This is our Natural Law Summit here, really, you know. Rajvinder Trikatu, Ashley, have the doctors any tips to prevent an impacted wisdom tooth from repeated infections? Does the lower impacted wisdom tooth just need to be removed via surgery? Thank you. Well, I would say gum care oil would be one thing, and oil pulling, and all of the things we suggest in the oral hygiene section of our daily course would be good things to do. We have a specific gum care oil, the oil pulling with the sesame oil, and any other suggestions there for that?
If you
So
take a Trafala tablet
Tifala tablet, yeah.
and you put it in by the tooth and leave it there overnight, and in the morning it's all a go, you rinse your mouth and spit it out. And you do that each night until any inflammation is settled. And then you can redo that if there's any sign of it recurring.
Okay, so Tamara is on the line and she says you need to soak the aloe vera in water for 24 hours before eating it or applying it to the skin in order to release the acidic fluid that it contains. Okay, so that's another thing. If you don't have time to make that special curry that Rajvinder's grandmother used to make, you can just soak it in water for 24 hours. We don't have too much time left. Sanja says, my question is there any medication available in Ayurveda for ADHD in kids? I think the best thing for ADHD in kids is to learn transcendental meditation. There are some very nice videos on case studies where they have taught kids transcendental meditation. I suppose it's got different levels for everybody. Do the doctors have any, maybe something similar to what we recommended earlier on with the Brahmi ghee?
Steady power. Steady power. Syrup.
And study power, yeah. We have the syrup.
Yeah.
Study power syrup.
Yeah.
Yeah, okay. So if you just put study power into the search box on our website, you'll be able to find that, you know. And you could Google transcendental meditation and ADHD as well, because there is quite a bit of research done on that, you know. So we answered that one already. Let's just go back here. Okay. So this is from Jenny. She says, I'm particularly prone to mosquito bites. They just love me. I'm traveling abroad at the weekend and wondering if anything can be taken internally to deter them. Also, what works externally on skin bites, on the bites themselves. Well, citronella spray, Forest Essentials have a lovely spray for helping to prevent mosquito bites. I mean, the best thing to do is cover up. I mean, the best thing is always prevention. So I've been in a lot of mosquito areas recently, and definitely at nighttime in restaurants, they tend to nibble on your ankles. So even if it's warm at nighttime, just wear a pair of cotton socks and just cover your ankles and wear a long sleeve shirt, even if it is warm, because they're out and they're about and they're trying to bite you, you know. But MA 630, yeah, MA 630, yeah, is very antiviral, and we recommend it to people traveling abroad as well.
Antimalarial as well.
Malarial,
So
yeah.
you take it at least a week before, so that it build up in your blood, and your blood has kind of that different aroma that doesn't attract the mosquitoes. So that's the one way, and you keep it in your room where you're sleeping. I think the aroma of the tablet might push them away as well. But citronella is very good. Neem oil is very good. Yeah, so in the health store, they do some kind of natural mosquito repellent.
Yeah, they do a lot of very unnatural ones as well, but
yeah, they do some chemical ones.
Yeah. The other thing is that what works externally on the bites? Is there anything that I got a lot of bites, even though I'm saying I did those things, but I still got bitten when I was in India and down in Kerala.
Inhalation oil.
Little drop, yeah, that's what I used actually. Yeah, little drop of it.
It has tea tree in.
Mosquito likes pitta people, especially the unbalanced pitta people.
They're unbalanced. Yeah. Okay. No, they do. It's funny. They just get attracted to certain people, and the same with midges, and the same with those horseflies as well. I was walking up in the Poison Glen in Donegal.
Horseflies are dreadful.
He was walking with Declan and his brother up in the Poison Glen in Donegal about 2 years ago. And myself and Declan were not being bitten. And his brother was being bitten so badly, he had to turn around and go home. And then after he went home, I started to get bitten. So should have kept them on, you know. Anyway, Jenny, I hope there's some information there. Depending on where you're going, but you can get natural sprays in the Forest Essentials do a nice mosquito repellent spray. It's probably a little bit expensive because I think Estee Lauder is the crowd that distribute that. But I got one of them in India and I found it very good, you know. Jordana Kelly says, may I ask which doctor should I book a consultation with for my MS? Geez, that's a dangerous question, Jordana. We can't answer that. Whichever doctor appeals to you, they'll all be experienced at dealing with that. So whatever doctor appeals to you, it's just the best way to go. Let me see. We probably have time for one more. That's mosquitoes. Let's see. Okay, so this probably is one for you, Rajvinder. I have a question for tonight's meeting, please. Is there an optimal amount of protein that we need? Context, I'm a 61-year-old woman, weigh 105 pounds and 5'4". I hear different views on this subject. Some say we don't need much, others say as we age, we need more protein. Can the doctors please give their views? I get my protein from meat and fish, as unfortunately, I cannot tolerate legumes or beans. So,
yeah, well, Ayurveda is not really dividing food into any groups like carbs and protein. And I know there is a buzzword protein nowadays, everybody's saying protein, protein. But if you have a balanced diet, carbs are very important as well. You do need carbs, especially when you go towards 60, which is Vata phase of the life, then carbs are more grounding. And some people, yeah, unfortunately, are not able to digest a lot of grains and legumes and beans. So their source of protein in the Western diet is meat and fish, which is all right as far as it is a good source. Like, especially when you're eating eggs, let's say, if you're eating commercially produced eggs or you are having free range organic eggs, there's a big difference. So I kind of suggest you go for free range organic as much as possible and avoid those commercially eggs. They're nothing in it really. They're just injections given to the hens and just the byproduct of that. So yeah, so if you have for Vata people, the plate is like 50% is carb, which is good news for Vata people, and 30% or even 25% should be protein, and then 25% is the vegetables or and they should have small amount of dairy with it, which could be ghee that you are using for as a cooking medium or other healthy fats for cooking. So yeah, don't worry too much. Don't get caught up with this kind of this new diets coming all the time, this and that, keto and blah, blah. Don't. If you're following, they work, they all work. I'm not saying they work for short term. And then if you're doing, Ayurveda say moderation of everything is good. And we heard the expression excess of everything is bad, even though if it's wonderful protein or something, if you're overdoing it, you're gonna end up having either too much of kapha or too much of pitta or this and that. So stay in the middle, have a balanced diet. So that's the kind of what I really suggest.
Oh, what
okay.
strikes me as well is, you're taking meat, which is protein mostly. So
Yeah.
you can't say that you're lacking in protein. However, your age profile also has to be considered, and it's worth keeping in mind that the digestive system, the fire is not as strong in the 6th, 7th, 8th decade, which is also a reason that we tend to eat less as we go on and need less because we're slowing down. So I think, be sure not to be eating your meat at night because it's too heavy. You should have that in the middle of the day, and anything you can do to support your digestive system will mean that you will digest and absorb more carbohydrates, more proteins, and more oils that you need. So that's all I'd add.
And the form of the meat and the fish also depends to aid the digestion. So if you're having the chicken soups or like a meat soup, you can help yourself to digest it better. The smaller the size of your meat, the tender your meat, the faster you'll be able to digest. And if you don't have any sugar craving, unnecessary sugar craving, it means it also indicates that your protein requirement, whatever you need, you're fine. But if you are like having a lot of sweet craving, that somehow gives an idea that you're lacking in protein. But I would say,
Also, it's the
Yeah.
vegan people which always have to keep an eye
Yeah.
because they are vegetarian, vegan people. If you're not taking dairy either, then you have to be like, make sure you're not losing weight and your muscles are not wasting away. Especially if you're talking about MS and all that kind of where muscle are wasting very quickly. So that's you need a very balanced kind of protein and other ingredients. And as Dr. Nahid said, the cooking process is very important. If you're buying like one of those corn products or processed and eating, you're hoping you get good protein to those. No, not really. So if you're cooking yourself with your love and care and all the spices and enjoying the process and eating mindfully, then the food is absorbing very well and you don't have to worry too much.
Okay, so we're going to finish with a poll of the 4 doctors and me. And this is for the last question. You can say a yes or a no. And so this is from Peter Ward, and he says, my question is, we are all familiar with advice against microwave ovens. Yes, we say throw them out in that they remove the prana from the food. Air fryers are now the rage. Is there an Ayurvedic guidance on the use of this equipment? So air fryers, I would not use one. Anyway, Rajvinder, yes or no?
Air fryers, actually, they have a coating material, which is a non-stick material, and which is not recommended, and it is toxic for our body. So I would not recommend you to go for air fryers, but you can bake anything in the ovens. So that is one of the thing, and even you can use cast iron pans, which can be even used in the ovens, and you can just grill and bake in the oven instead of using
I
air
will
fryers.
make it a little more tricky. If you have to choose between air fryer and microwave, then you go.
Oh,
with
no.
the-
No,
No, that-
no, there's no
because
choosing here.
because there are like groups like air fryer recipes and this and that, which means you are completely using air fryer and people use it. That's the fact anyway. So it's just like try not to do all the cooking with air fryer. Have other mode of cooking as well. Use stoves and use good pans and pots and stuff like that. And if you have small kids, younger teenager kids, yes, they're those fries and burgers they eat, then the air fryers are handy for that purpose if you have a family.
I'm going to
But if
simplify the
you
question for you a bit.
if you have to make a healthy choice, no, I'm not suggesting.
Air fryer.
I'm not suggesting yes. No. I'm not saying yes. I'm saying don't use it for every meal that you're cooking. Just if you have to, if you can resist it, wonderful. Don't have it.
Does
Okay,
it,
so
does it
it's 2.5
provoke
minutes.
flatter? Does it
Sorry,
provoke
Ron?
flatter? Because it's so fast, you know, I mean, that's the idea is speed here.
Yeah, it's fast cooking.
Here. So will that not provoke fat as well in the fat time of life?
It is a bit like sorry, Dr. Tali, you can take it. No, he's not happy with me.
I was just answering his question. That's it. No.
Yeah, it is in between, I say, microwave and oven. That's the technology. But it would have Teflon coated. So you look for one, maybe there could be one that doesn't have Teflon coated. I think there are. So you go with no non-Teflon ones. And I don't see a major problem if there is no coating. And you can set the temperature. But again, don't cook vegetables or those tender foods in it. It is mainly if you're cooking something occasionally, I think.
Okay. But I can safely guess that none of us have an air fryer. Now,
People are crazy. Yeah, people are crazy
So
about it.
I would-
It is trend.
I would also say that you can use air fryer in moderation if it's making your life easier. If you have kids in house and they are looking to have chips, which is like deep fried,
Yeah.
always better that you give them in an
Yeah,
air
you're not
fryer.
using oil.
Yeah,
Especially
so-
Indians eat a lot of samosas.
Because when you deep fry the potatoes, they release a toxin which is called acrylamide, which is carcinogenic. So it's obviously a better idea that you can air fry the chips, and you get those paper like the baking paper, which you can, if you have like the coating one, the non-stick one, you can place it in your air fryer, and there are air fryers available. People are very intelligent nowadays all over the world, so they know that the coating is bad, so they have like a new few air fryers which have like a steel one, so you can buy those. And I would say that if you have someone at home who is like especially the kids who are like looking for to have deep fried chickens or like deep fried any item, then I would say it's always a better idea. But do everything in moderation. So if your a meal is like something from the air fryer, then I won't recommend. Sometimes just to treat yourself, I would say you can use a air fryer, and air fryer is basically very small. You cannot cook a lot of things at a time. So
Like people cook their
ultimately,
porridge in microwave. You don't need to do that. You cook your
yeah,
porridge in pot. The same go with the air
yeah.
fryer. You don't cook your khichdi lentil in the air fryer. Cook that in the pot.
In the pot, yeah. Okay, I've changed my mind. I'm going to buy myself an air fryer tomorrow.
No, you don't need. You don't even eat
No,
any.
you have an oven, so you can use that, and you are
Yeah,
not a kid.
I'm only joking. I'm going to stick with the way I've always been cooking, which is I have a cast iron pot that I use for everything. Okay, everybody, that's it. I think we've got to the end of it. We haven't managed to answer all the questions. Actually, there's an awful lot of questions we haven't answered, but anyway, we did the best that we could. And but thanks a million, everybody, for coming on. We'll put this up on I'll put it up on YouTube tomorrow, so a lot of people will be able to review it, or people who didn't see it will be able to go over it for the first time. So that's great, everybody. Thanks a million. A big thank you to the doctors for coming on. Thanks, Dr. Dom, Dr. Ritvinder, Dr.
Good
Terry, and
night.
Dr. Naheed. And I think
Good
a few of
night.
us are meeting
Thank
up
you
at the
all.
weekend.
Bye. Thank you.
Bye-bye. Thank you.
Okay, everybody, take care. Bye-bye. Bye-bye. Bye-bye.